Good morning, all of you. It's an important day for all of us, particularly when our graduates come back. I wasn't sure where I'm going to go, where I'll be, but I just wanted one thing. I just wanted to be in an environment which is spiritually sound, and because that's the only thing I can link back to home with. You don't have your parents, you don't have your family around, but if you have same people that from you can say from church and from your home, it makes sense. So God answered that prayer, and God honored my desire.
So I'm very happy working there. There have been difficulties, but God sustained me. So first of all, the language was very difficult. The patients didn't understand what I said, and I did not understand what the patient said to me. So I tried learning the language, and after 1 month, I learned the language. And people do not prefer a female doctor. They always want a male doctor, and finding I am so small and very tiny, they come and ask me, where is sir? They ask, I said, I am the doctor here. What happened? You can tell me. Then they're like, no, we want to see a male doctor. Then they go like that. Initially they used to go like that, but I managed to convince them, and then finally they used to come and get treatment done from me.
And then in Ruxall I learned one thing. It was a dental conference, annual dental conference. A lot of new things we learned. But the main thing that I learned was I always had this feeling in my mind, am I good enough to do this? But what I learned from there is, it's not about what you are, it's about who you are. God has called you for who you are, not about what you are. So just submit everything into His hands, and over there we have trainees, assistant trainees, dental hygienist training courses, nursing assistant training courses. So we're supposed to take classes for them. So we try and teach them anatomy and physiology in whatever language, Hindi or English, whatever mixed up languages we can. So I really want to apologize to all my teachers, because only when I tried and attempted to teach them, I understood how bad it is when they do not respond back.
First question, they come and sit in a chair and say, yes, and are you a student? No, we are doctors, only just problem is we don't have that much looks as a doctor.
That was the kind of fear I had in my mind. All medically compromised patients I was very scared of. But as I told you, I am very blessed to come from a college like this, because I have not seen any of my other 6 junior doctor friends calling up their teachers back their college for help. But I called my teachers. I'm so, I don't know, from my bottom of my heart, I thank all my teachers for attending all my calls whenever I call them. I'm really, really thankful to all my teachers and all my dear friends.
My hospital is situated right at the center of Chennai. It's in the heart of Chennai. Chennai is a place where there's a lot of dental clinics. Like you walk from here to your Brown hostel, there'll be at least 3 dental clinics. So I was thinking before I used to go, will I get patients? I don't think I'll be mostly sitting and doing nothing over there. But by God's grace, I have enough and more. My hospital is very charitable, so it's the cost is reduced. Like in Chennai, for an extraction, they cost you 1,000 rupees if it is a private clinic. So we cost here 400. So many patients flow. And ethics, I really thank all my faculty for teaching me the word ethics. The most terrible thing I saw was like there's a huge cavity and there's cotton in it. It's RC treated according to the patient. There's a big cotton that I took out. No obturation, nothing. And the patient has paid for that FPD for around 25,000 rupees. So after that is when we get these patients. So I really thank that the word ethics that was being taught in our classes, and especially that we should do it right.
It's not the place that matters. Wherever you are, you make a difference in that place. I think mission is what you do and what the reason for what you're doing it?
Maybe because I am also small. After all the consultation and explanation, they'll ask, "Sister, now when is the doctor coming?"
I actually, when I joined, in a week, I haven't told this to a lot of people, I left the born place because it was very difficult. I went back home, I talked to AV sir and Koshi sir, and they were very supportive. It was good to know that the college has not given up on anybody from a batch. It felt very good. But then in a couple of weeks, I went back, I joined, and I think I'll continue working there.
In my class, I was the one who had fainted 5 times at the sight of blood. But being posted in oral surgery, I had the opportunity to look up at so many cases. I've grown, I've been able to deal with patients. I can say I'm more confident even when you get to observe cases, what sir does, what Gandhi sir does, Manisha ma'am, Ashwin sir, they'll teach you while you're standing by their side. And you tend to observe more keenly and learn. The next time I do it, I remember what you guys say and do. And it has helped me a lot.
I've realized one thing in this past few months. It's not about what you know actually, because even if you know stuff, you might not be able to do it. In camps also we have these extraction patients and everything, and sometimes it's a little scary to refer it here because we know that the two might or might not come. And if we refer it here and then everybody finds it easy, we might get screwed for that. So I was a little scared. There are times when we got stuck and then I just pray God the tooth should just come out. And then I open my eyes and then I see the tooth popping out. I don't know how. So basically I realized that it's not about what you know. It's just how God wanted to be. So.
And then when you are alone, I have gotten stuck a number of times. But then just like all my friends said, it's all God who have actually helped all of us. And being alone there actually have gotten me spiritually more stronger, because he is the only person that I can look up to, because I don't have the place where our clinic is, there's nobody around. So it's like just me and my patient, and I don't.
It is emphasized over and over. We heard it again from different contexts, how God has been your guide and mentor, and we appreciate your acknowledgement to the teachers and the response some of you gave about how difficult it is to be on the other side, and thank you.